I'll now turn it over to Dr. St. John.
I'm here today to speak to the issues around child and adolescent psychiatry. Currently, within Eastern Health, there are approximately 7.5 full-time equivalent child psychiatrists. There are a couple of child psychiatrists outside of the St. John's area, or outside of Eastern Health area. They've been hired, however, to provide psychiatric services for all of the population. What happens with young children, which again have been demonstrated repeatedly that they, at 18%, have mental health issues or would fulfill the criteria for a diagnosis at any particular time. They often have less severe or less acute illnesses, so that adults will get seen if a person is having to do both adult and child. The current, we had a review about a year ago, and at that time brought forth the numbers again that the Canadian Psychiatric Association recommends, and that's 1 per 4,000 children. The current estimate is that we're at about 1 per 16,000 children within Newfoundland and Labrador, which means we have excessive waiting lists. Currently, if you're not an emergency or an urgent case, you will wait 14 to 16 months to be seen. So who is that? That's not the suicidal or homicidal or the psychotic or severely ill. It tends to be the behaviorally disordered children and the younger children. If you wait 16 months when you're 5 years old or 6 years old, that is a huge proportion of your lifetime. The stigma that comes with that and the difficulties that sets you up throughout your lifetime for self-esteem, academic problems, all of those other things is paramount. It leads to increased use of substances in adolescence. It leads to decreased vocational achievement as an adult. So it really sets young children up for a lifetime of disability. Many parents will say, I don't want my child labeled. I think the downside of that is if you go into a grade 1 classroom and ask the kids who has the problem, they will identify the child that has the difficulties very clearly. So the stigma piece is huge for young children, but it's also, I think, because children wait, the longer they wait, the more disabled they are. So if the parent decides instead of at 6 to have the child seen at 8 and they have to wait, you're now looking at a 3 to 4 year wait time that's difficult. Compounding this is that there are only approximately 12 child psychiatrists graduated in the whole country in each year. All of the child psychiatrists that are currently in this province within Eastern Health have graduated from memorial programs. The issue around recruitment and retention is going to become more acute over the next couple of years because they have changed. We have finally recognized as a subspecialty. But that requires now an extra year of training and an exam at the end, and so that's going to mean people are going to have to choose between going into practice, often with huge student debt, or remaining in a training program for another year. So the likelihood of our services increasing over the next few years is probably diminishing. We're hoping that it's not going to be, but I think people are approaching this new situation with a huge amount of trepidation of what that's going to mean. Since I started here 20 years ago, this is the most we've ever had, but in every other occasion when we got up to 6 or 7, within a year and a half we were back down to 2. And throughout my 20 years, probably a third of that time we have practiced with 2 to 3 people in the province because we haven't been able to keep people. It becomes Band-Aid psychiatry, people get sicker, they wait longer, and the long-term disability becomes much higher. So I think that's from the child and youth perspective where we are. We have no services often in communities. We send children back to the Great Northern Peninsula or Labrador with very limited support, and it makes it really difficult. So we wind up providing, instead of tertiary level care often to other areas, primary and secondary level care, and that just increases our waiting time because we can't discharge patients. A lot of them don't have family physicians that are stable or who are willing to take on these children who often have chronic disabilities. The other issue that happens is when the adults' capacity fills up, we can't graduate those of ours that require long, ongoing care. So the result is I have a number of kids who are attending university who require ongoing psychiatric care that because of the adult capacity issues, we're not able to move on. So it just perpetuates the entire problem. That's the youth perspective, and I'm going to move over to Chris so that he can give you the rural perspective.